Welcome everybody. My name is Sophie Scott. I'm the medical reporter for ABC and I'm going to be your host for this event. I'd like to acknowledge the traditional owners on whatever land you're on right at the moment. For me, it's the Gadigal people of the Eora Nation. And I pay my respects to elders past, present and emerging. I also want to recognise any Aboriginal or Torres Strait Islander guests joining us today. I would also like to acknowledge any people with lived experience of mental health, drug and alcohol issues or suicide, and their friends and families and carers who might be joining us on this important webinar today. So welcome everybody to the launch of the Australian Commission on Safety and Quality in Healthcare Digital Healthcare Standards for Mental Health. This is really a very important launch. Thank you for being here, and we know you're all very busy, so we do appreciate your time here today. If you're on social media, we would love you to share this conversation with the wider world. If you're on Twitter, you can follow the Commission. Their handle is ACSQHC, and also mine is Sophie Scott and the number 2. And the hashtags are COVID-19 and safer digital mental health care. And so if you are on social media, please post some photos or quotes from today's event about these standards. So that way we can get the message out to everybody just about what these standards are all about and why they're so important. So again, if you're on Twitter or Instagram, please follow those handles, and we'll also post some links after the event to the standards so you can read them and see them in detail. So just again, the Commission's Twitter handle is ACSQHC, and mine is Sophie Scott and the number 2, both on Twitter and Instagram. So in this year, this once-in-a-century event that we've all lived through, many of us have turned to online services like never before, and that's true for mental health as well. And the introduction of these world-leading standards for digital mental health care couldn't have come at a better time, even though they've been 2.5 years in the making. 1 in 5 Australians and 1 in 7 teenagers will experience mental health issues at some point. So we need quality, safe and digital mental health care, which can be offered in addition to quality face-to-face care. And the digital health care we'll be talking about today includes everything from websites, apps, telehealth, phone, video and phone call services. And this launch, you're going to hear from the speakers who've been involved in crafting these very important guidelines. And they've listened to the service users, the people with lived experience. They've listened to clinicians, to service providers, to ensure that the standards would be easy to use, useful, and also ensure safe and quality mental health care for all people in need. So please tweet, Instagram, post links. Love to get your thoughts and comments and feedback. And now it's my great pleasure to introduce our first speaker, Dr. Peggy Brown, AO, who's the Commission's Senior Clinical Advisor and was very involved in these standards. So please welcome Peggy.
Thank you very much, Sophie, and welcome to everyone. Thank you for joining us today for this exciting event, the launch of the National Safety and Quality Digital Mental Health Standards. The Commission is very pleased to be launching these standards today. The standards cover mental health, suicide prevention and alcohol and other drug services that provide information, digital counselling, treatment and peer-to-peer support services that can be delivered by telephone, video, internet, SMS or apps. As Sophie indicated, the standards were developed via an iterative process in collaboration with people with lived experience, health professionals, technical experts, academics and experts in digital mental health, service providers, peak bodies and professional associations. Their aim is to improve the quality of digital mental health service provision and to protect service users and, where relevant, their support people from harm. How can standards do that? Well, the standards set out a nationally consistent statement about the level of care that service users and their support people can expect from a digital mental health service. Now, to meet the standards, service providers will need to have in place systems and processes to ensure that their digital mental health services meet these expectations. And with the standards in place, individuals who use or recommend digital mental health services that meet the standards will know that they are safe and effective. So why have these standards been developed? Well, the need for mental health services has never been greater. Even before COVID, 1 in 5 adults and 1 in 7 teenagers, as Sophie indicated, would experience a mental health issue in any 12-month period. But not everyone who wanted help was able to access help. And of course, COVID has come along. It's had a significant impact on the mental health of Australians, and we've seen demand for services grow as a result. And many of those services are now being delivered digitally. Digital mental health services provide significant opportunity to meet the needs for mental health care. And as Sophie said, not necessarily as a replacement for traditional in-person face-to-face services, but as an additional service option. Digital services offer many benefits. They can be more convenient because they can be available at a time and a place that suits the user. Some services are available anonymously. They're usually available at low or no cost to users, and they can be cost effective for service providers as well. They can also reach people for whom traditional mental health services may be harder to access, for example, those living in rural and remote areas. But as we embrace digital mental health services, we must ensure that they are safe and effective, that they're based on the best available evidence, that they deliver the benefits they claim, and that they don't cause harm. And that's why the Commonwealth Department of Health contracted the Commission to undertake this work. We commenced with a broad consultation process in mid-2018. We actively sought out the views of key stakeholders, of experts and the community, first of all about whether standards were needed, and if so, what was important to be included in them. Now, there was overwhelming support for having digital mental health standards developed. I think put plainly, people wanted assurance that they can have trust and confidence in mental health care that's delivered by digital means. But service providers also welcomed this initiative. They saw the value in having a quality assurance framework that helps them to get it right. So we took the information from the consultation process and we used it to inform the design and development of the National Safety and Quality Digital Mental Health Standards that we're launching today. There are 3 standards: the Clinical and Technical Governance Standard, the Partnering with Consumers Standard, and the Model of Care Standard. And within those standards, there are a total of 59 actions that cover domains such as the evidence base, quality and performance of digital services, effective communication, recognising and responding to a deteriorating mental state, privacy and data security, terms and conditions and informed consent, usability and accessibility of services, then governance, and also partnering with service users and their support people. The standards also emphasise that people should have the information they need to make an informed choice about whether a service is right for them. Now, the standards are written to cover all potential users, from children to adults and older persons, to those who may be vulnerable or may have special needs for a range of reasons. In applying the standards, service providers need to consider those needs and the abilities of the groups their digital mental health services are delivering service to, and ensure that those needs are appropriately met. Fact sheets that provide more information about the National Safety and Quality Digital Mental Health Standards are available on the Commission's website. There's also a tip sheet on how to choose a digital mental health service. From today, service providers are encouraged to implement the standards on a voluntary basis. They can use the self-assessment tool to find out how they're tracking, and to monitor their progress as they make improvements to meet the expectations set out in the standard. An independent assessment scheme that can verify a service provider's independent assessment, service provider's self-assessment, I beg your pardon, is currently in development and is anticipated to be available for implementation from late 2021. Consumers, carers, families and support people of those who use digital mental health services are encouraged to learn about the National Safety and Quality Digital Mental Health Standards and to share this information with their friends, colleagues and networks. Importantly, they can also ask the provider of any digital mental health service they use whether they meet the standards. The Commission will also continue its work to raise awareness of the standards as broadly as possible, including with policymakers, funders, regulators and educators, and with our international colleagues who've been watching our approach with significant interest. I hope that has provided you a concise overview of the standards and why the Commission is pleased to be launching them today. Back to you, Sophie.
Thank you very much, Peggy. And Peggy's going to stay with us now for the panel discussion. So as well as Peggy, we're going to be joined by Professor Nick Titov. He is a Professor of Psychology at Macquarie University, and he's been involved in developing, evaluating and running digital mental health services for 15 years. And he was involved and developed the MindSpot Clinic, which gives services to 25,000 Australians each year. We're also joined by Miss Eileen McDonald, who is the New South Wales Carer Representative on the National Mental Health Consumer and Carer Forum. And she has been very closely involved in developing these standards. And we also have Samuel Hockey, who works at the University of Sydney as a Youth Mental Health Ambassador. He's a former National Mental Health Commissioner, and he seeks to amplify the voices of real people and their experiences of mental health. So we're very glad to have all our panellists join us today. So thank you very much. The way this part of the launch is going to work is I'll ask the panel a few questions, and then at the last 10 minutes, we would love you in the audience to be putting your questions forth. So if you start thinking about questions while our discussion's going, and I'll be able to see the questions coming up, and we'll aim to get to as many of them as we can. So please be thinking about the questions you'd like to ask the amazing panel we've got. I think the key question, and I'll put this to each of the panellists, is just why are these standards so important? So Peggy, let's start with you, and we'll go through the whole panel. From your point of view, why are the standards so important?
Well, Sophie, from my perspective, it's really important that people who need access to care are able to get access. And we know that to date there has been an unmet need out there in the community. So if we're adding a new way of accessing services, we'll be able to reach more people, reach people who, as I said, may not have been able to access traditional services. And if we know that the care that they're accessing is safe and effective, then we'll be a significant step further forward.
Okay, and Nick, what about from your point of view as a service provider? Why are these standards so important from a service provider's point of view?
Hi, Sophie. Well, look, I think probably the first point to make is that standards are strongly welcomed by the sector. Now, our services are always trying to provide care which isn't just safe, but also high quality. I think what's really important about these standards is that they provide a framework of expectations as well as practical criteria against which we as service providers can measure the quality and safety of our care across key domains.
Okay, and Sam and Eileen, let's go to Sam first. Why were these standards so important, do you think, and why were you so keen to be a part of this process?
Yeah, I particularly want to echo what Peggy said around the fact that we are expanding what individuals, I guess, are able to access when it comes to care, but particularly what types of care and the appropriateness of care and quality of care in which individuals are able to access, particularly when it comes to rural and remote communities and the access that they have to, I guess, quality levels of service and care.
And Eileen, from your point of view, why are the standards so crucial? Why is it so important that we have standards when it comes to digital mental health care?
It is just so important that we don't trust our personal information, much less our mental well-being and health, without being informed and making informed choice and knowing that we can have safety and privacy and quality in that process. And I believe these standards will help towards providing that.
So at the moment, I'm keen to find out how hard is it for service users to know if they're getting evidence-based digital mental health care, and how will the standards change that? So maybe we'll start with Peggy again.
Sophie, look, I think the short answer is it's quite difficult if you take the kind of global perspective. Obviously, there are some services that are provided by well-known and highly reputable organisations, such as Nick's digital mental health service, Mindspot, and I think anyone using such a service would have a reasonable level of assurance that they're receiving care from health professionals who are experts in the field, and that they've developed a service with all aspects in mind, including things like security. But of course, there are many, many different types of digital mental health services provided by many different providers. If you go and look at an app, mental health app, for example, you're probably not going to know who's published it. You probably don't know what evidence there is behind it. And it's highly likely, even if you take the time to go and read the privacy policy and the terms and conditions, if indeed they're set out at all, that you won't be any the wiser in terms of knowing what they're doing with your data or the evidence base behind it. So it is highly variable at the moment. And that's one of the things that the standards are aiming to change.
And Nick, just from a clinician's point of view in recommending digital mental health services, how will the standards help clinicians feel more confident that if they are recommending for people to use these different digital services, that they are evidence-based and that the person will get a good quality mental health care from it and a safe experience?
I think one of the key points to recognise is that the new standards define criteria across multiple domains, and that should provide a lot of assurance for clinicians in terms of credibility, in terms of accountability, that there are not only processes in place for ensuring that the services are well constructed, but also that they're well governed, and that there are clear points for evaluation, and as I mentioned, accountability. So I think it raises the bar in a very positive way.
And Sam and Eileen, from a service user point of view, how important is it that the services have an evidence base to them? And do you think how important is it that the standards will focus on that, so that people, if they are engaging in an app or a website or telehealth, that they know that whatever service they're using, it has an evidence base to it? So Sam, how important do you think that is?
Well, I think that particularly when it is being prescribed from the context of a clinician prescribing evidence-based at every point of view, that we as consumers and as carers and as loved ones, we're also aligning ourselves in the way in which we also socially prescribe those tools and those e-therapies to our friends and our families and ourselves. And I feel like the more that we align those evidence-based, which are evidence-based for a reason, and they obviously work for a reason, the better we are able to therefore adjunctly align with and streamline with what a clinician might need to speak into or have to say on said issue or matter.
And I might just move on to the service providers and industry point of view. What's been the feedback from service providers and industry when you started talking about the standards? Has there been any resistance from the industry, Peggy?
No, look, Sophie, we've been really, really pleased that service providers and industry generally have welcomed these standards. Indeed, many service providers had been asking for standards to be developed. And as Nick said before, they actually see it as a way to help them to improve the quality of their services, to know, provides a broad framework to across multiple domains in terms of what should be provided, what the expectations are. So it gives them a great way to actually look at continuously improving their services. And so we really haven't met a lot of resistance to date at all. I mean, there are, some issues that have been raised around assessment against the standards in terms of what it might cost and what kind of administrative commitment it might take. But overall, people have been very, very enthusiastic about the standards.
And just sticking with that for the moment, Nick, can you just tell the audience, what was it like? You were part of the pilot program for these standards. What was it like going through that pilot process, and why was that so important?
It was actually a really rich experience. I'm sure my team won't mind me saying that, because for the first time it defines, if you like, against external criteria, what it is we should be, what criteria we need to map ourselves against, and probably just a point around that. The field has evolved and it's maturing. I think these standards really recognise that. But one of the things about this field is that it's actually been driven by people from many different backgrounds: clinicians, IT experts, commercial people. And so as a consequence, understandably, we've all wanted to do the right thing, but we've all had blind spots. And what I really like about these standards is it helps to surface all of the key domains we need to be looking at. So when MindSpot piloted the standards, our IT team, our clinical team, our governance teams could get together and say, okay, now we have a common frame of reference.
And I like the way when we were talking, you described it as like a common source of truth that everyone could sort of look to when they were looking at the sort of services that you provide.
Yeah, and Sophie, look, we understand that the field will evolve rapidly, and I think all credit to Peggy and the team at the Commission for recognising that and recognising that the standards will iterate over time, but those if you like realities and nuances of understanding are built into that. So we know that it's a work in progress, but a great start.
So let's move on to the service users perspective, and I'm really keen to ask both Sam and Eileen, what were your top priorities when you sat down with the Commission and the working groups to draw up these standards? What were the top priorities that were the top of your list when you were drawing up the standards? Eileen, what were the things that were sort of non-negotiables for you?
What I found out through consulting widely across Australia was that the concerns that people have to be able to make an informed choice, that they be able to know with some confidence about safety of their personal information, and just the choice and control to make a more informed choice. And exciting for service users is a lot of the services are being developed by service users, and this gives potential for all kinds of innovation in a safer way.
And you also mentioned when we spoke that confidentiality was a big issue as well, that people's data wasn't going to be on-sold or unused in any way. That was really a key point as well.
Yeah, absolutely.
And Sam, what about you? What were your key priorities that you really wanted to see in these standards from a service user's point of view?
Yeah, I think one of the big things that we're seeing at the moment in the mental health space with the involvement of lived experience is the pushing for co-design and co-development with lived experience, and whether it be a clinical party or a government party or a programming party. And so I think one of the big things that we heard that was needed was the transparency around whether it was co-design, co-developed, or consultation. And so knowing that having the knowledge of being able to pick whether, not just based on whether it was co-design, co-developed, or consulted, was a big plus. so that we could, as individuals, be able to work out, okay, cool, so this is completely led with lived experience at the front, or this is built with lived experience's voice at the heart of it, or this is being consulted by lived experience and really has taken their voice on board and what they want on board. So that was a big thing.
And what about, so at the moment, because there is so much choice, I guess that's, you know, a good thing, but it's also probably can be confusing as well for people, I would imagine, because there's so many apps and so many websites and so many different options. How difficult is it without the standards to know the quality and the safety and the transparency of what you are using?
I think it is so hard. I mean, it's almost like going to a supermarket and trying to work out what type of milk you want. There's beyond so many kinds even now for a type of soy milk. So I think that the more information we're able to provide about a particular type of service and easily provide that type of information, whether it be through a simple digestible approval or whether it be through a larger, more digestible format, then we're able to allow the individual at the other end to decide for themselves what they want out of the service and what's going to give them more so.
And make more of an informed choice. One of the things one of the things that was mentioned in the information about the standards was the potential of, you know, potentially down the track having some sort of rating system or, you know, tick, like there used to be the heart healthy tick, and now we've got the health, you know, the health star ratings on food. So I'm keen to just ask the panel about that and how that might work, and whether that's something that both service providers and service users would want. So maybe we'll start with Peggy. Tell us about that idea. How would that work, and where is it up to in terms of, obviously not at the moment, but is that something that might be looked at down the track?
Yeah, Sophie, when we undertook the consultations, we did hear repeatedly that people want an easy to understand but reliable way of knowing whether a particular service is right for them. We're not there yet in terms of having that, but it is part of what we're considering as we do this next piece of work around developing up the assessment. Now, there are different aspects to that, of course. You clinicians, for example, who might want to recommend a digital mental health service are probably most interested in the evidence base, whether it's actually effective, whether there are any potential harms associated with it. A consumer or a carer might be particularly interested in the privacy and data security aspects. So there might be particular aspects that we might need to separately try and pull out in terms of rating. It might be a more global thing. That's something that we have yet to, as I said, to work out. Service providers, of course, would love the opportunity to have something that's easily recognisable that they can brand their service or their organisation with and use it to market their services. So we know there's a lot of interest in that particular aspect.
So, and Eileen, just from a service user's point of view, is that something that would be of use and of interest if there was a way to easily recognise that a particular service or app had met a number of the criteria of these standards and was of a sufficiently high standard?
I think all service users, the lived experience consumers and carers, would say that those kinds of indicators would be helpful, just like you do with cereal. However, at the end of the day, each individual still has to decide what's going to be trauma-informed care and practice, what's going to be safe for them, what the matchup is going to be if they want to trust it. I think the first process now needs to be for each person to check if the service that it is using the standards, does it meet the standards, and using the choice tip sheet that's on the website will certainly help everyone.
We're getting so many questions, so I'm going to go to the audience questions soon, just so we can get through as many as possible. But I wondered, you know, with technology evolving as so quickly the way it is, how can you future-proof the standards so that they're not out of date before they started to be used? For example, I know that some organisations like the Butterfly Foundation are already using like a chat bot on their website. So Peggy, what were the considerations in terms of future-proofing the standards to keep them up to date with innovations as they come along?
Yeah, Sophie, we did recognise from the outset that the nature of digital services is that they are agile and they are innovative and they will evolve quickly. So we were very mindful in writing the standards that we wanted to write them in such a way that they weren't necessarily just written for 2020, and that they could be they're kind of written at a high level, and they can be interpreted and applied to different services, different types of services, but the fundamental issues remain, and that's things like privacy, security, governance, all of those things that we've been talking about. But as Nick said, as digital services do develop, we will need to be mindful and review the standards with a view to whether or not they need to be updated in any way.
So we might just go to a couple of the questions. And we've had a question. Audrey asks, how do the standards align with the Department of Health national standards for mental health services, which are already required if you want accreditation? Maybe that's a question for Penny or Peggy or Nick.
Well, I can try and answer that for you.
Sure.
The National Safety and Quality Digital Mental Health Standards were based, we started the development of them based on the National Safety and Quality Health Service Standards, which are the standards that are mandated for all public and private hospitals and health services across Australia. And the National Mental Health Standards are a separate set of standards. There has been mapping done between the National Safety and Quality Health Service Standards and the mental health standards. And we have mapped our digital standards to the health service standards. So we haven't mapped them directly to the mental health standards, but if people wanted to, they could actually go to the two maps and do the alignment. But there is also a process underway in a separate piece of work at the Commission to align the mental health standards with the health service standards. So it's a watch this space on that front, but if people wanted to, they could look at the two maps that currently exist.
Okay. We've had a question about early learning services, and Jenny's asking, how could the standards be applied to organisations who are providing mental health and wellbeing services for early learning services in say it must be like kindergartens or schools? Is that probably Peggy again? That might be another question for you.
Yes, look, I think in general terms, it depends on the nature of what those particular early learning services are. Our definition of a digital mental health service is a service that uses technology to facilitate engagement and deliver care. I'm not sure whether that's actually what's being described in these early learning services. But again, I think the principles apply. You have to make sure that you have some clear leadership and decision making around what's important. You need to ensure that your governance is there, that you have safety and quality in mind in all aspects, not just in the evidence base, but thinking about the platforms and thinking about the environment, thinking about the personnel who might be involved and what their qualifications are and their supervision. Thinking about how you partner with those service users and their support people, in this case with parents and grandparents and other carers, ensuring that you're hearing their voice right through the whole process, from the design through the delivery and to the evaluation of the service, that you think about the communication, what's the digital literacy of the population that you're dealing with, and so all of the aspects that we've talked about, I think, apply as principles regardless of the age group or the nature of the service.
So we've had a couple of questions about the voluntary nature of the standards and whether it's something that the standards would, does the panel believe that the standards ever would or should become mandatory? So maybe we'll start with Nick and then ask our service users, Eileen and Sam as well. So Nick, the standards are voluntary at the moment, but how would you feel, or how do you think service providers would feel if the standards were not voluntary?
Look, Sophie, because the standards are, if you like, in their first iteration, I think it's really sensible to make them voluntary. There are going to be gaps. There are going to be unique services which don't quite map onto the overall standards. And we at this point in time, probably don't have a clear line of sight on exactly what those are. So in the first instance, if organisations can engage in a voluntary way, we will quickly identify where the gaps are. Over time, I suspect as the field evolves, matures, and perhaps becomes more sophisticated in terms of different models of service delivery, there may be specific groups which will have to have, if you like, mandatory alignment with standards. But we're not there yet. And I think early days is a pretty good space to be.
Okay, excellent. We've got an interesting question here from Cecily's asking, and it's about consumer behaviour. And I might ask Sam and Eileen. She's asking, do you anticipate that consumers, do they find it easy to switch from one service to another? So if, for example, when these standards come into being and people can realise that, oh, there's an alternative to what they've been using that actually has, is meeting the standards in a much better way, how easy will it be for consumers to switch from one service to another? Maybe I'll start with Sam. Is that something that people find it relatively easy to move from one service to another, or would they prefer to stay with what they've been using, even if it may not meet the standards as they are?
Yeah, I think that's a great question. First of all, so thank you. I think that the thing that is important is that if that service is working for you, even if it doesn't meet the standards per se, and if that service is making the improvement for you or your loved one or whoever's using it, then keep using that service. If you feel that you want to move towards a service that does meet the standards or does align with the standards. My apologies, there's a random fire going off. That's just 2020 in a nutshell. If you do want to move towards a service that is more aligned with our standards, then that is something that can happen over the course of time, and is something that a case manager or your clinician or your allied health professional would absolutely be able to walk side by side with you.
Help you through that process. Yeah, Eileen, from your point of view, from a service user's point of view, do you think, how important do you think the standards will be in maybe people's decision making on what they decide to use, whether they decide to stay with what they're maybe already engaging with, or maybe think about switching to one that might be reaching more of the standards?
Yeah, this is so important. I'm glad it was asked. Thank you. As the others said, that's all really true. And the standards are there to help everyone make informed choices. So it's about choice. Many of us, many service users will use more than one service. They might be on multiple things. And some of those services might have a level where one has to build a sense of real trust and therapeutic relationship. And that's quite different than a service where it's used when it's needed or for a particular purpose where that kind of engagement may not be as important. But I think everyone in Australia has concerns about how their data is used and how their personal information is used. So I would hope that the majority of services would take a good close look at how they can align in a voluntary way with these standards. And honestly, there's I don't know how many thousands of apps and everything else on the internet. And so we know that not everything out there will ever even check into this process. So it's really up to us at the end of the day to be really responsible for what we choose to do in a digital environment.
So we've got a question from Evan, who's asking, would there be infringements or fines or any sort of ramifications for services if they realise, you know, by looking at these standards that they're really not up to scratch, I guess. So they're asking, you know, while it's voluntary, obviously at the moment, would there be any penalties if a service or an app or a website or other digital mental health service realises, or the users realise that it's not meeting, say, worst case scenario, any of the standards? What could the ramifications be, if any, Peggy?
Yeah, look, Sophie, that's a really great question, and it's one that we have discussed particularly at the Digital Mental Health Advisory Group. At this point in time, there is no plan to have a penalty attached to not meeting the standards. We particularly want to encourage organisations to take up the standards, to assess themselves, to see where they're at, and to make improvements using the standards as a guide. If people feel they're going to be penalised in any way, they're less likely to even start the process, let alone embark upon the improvements.
So it's very much a carrot rather than a stick, from what I'm hearing.
Absolutely. But in developing the independent assessment scheme, which is the work that we're doing now and into next year, we certainly will be looking at what kind of data we will be asking organisations to be collecting and monitoring around their performance, and encouraging them to use that to measure their improvement. But yes, just stressing, we're not talking about penalties at this point in time.
So I've got a good question here from Cecily, who's asking, would compliance with the standards assist developers in gaining approval, say, for example, through like the TGA regulatory process?
Again, if developers conform to our standards, we think that it certainly will help them if they are developing a product that needs to go through the TGA regulatory process. Now, I just need to stress that we have been working very closely with the TGA, trying to avoid the situation where developers or service providers need to meet both sets of standards, our standards and the TGA requirements. So our standards will largely be utilised in the space for digital mental health services that are not required to meet the TGA regulatory requirements. And there are the TGA regulates a very small sector of digital mental health services, and our standards will apply to the rest. But there's no question that our standards provide that very broad foundation across those different domains, and they will be important and helpful for anyone who is actually going through the TGA process as well.
That's great. And Beverly's asking a question. We've had a couple of questions about the NDIS, and this one sort of sums it up a little bit. She's asking, how do the standards apply to the disability sector? Can they be used by people who are involved, say, with the NDIS system? And is that something that you thought about when you drew up the standards as well? Maybe, sorry, Peggy, to keep asking you, but
that's okay.
Had a couple of questions about that.
Yeah, look, great question again. And yes, I think the short answer is yes, they can be used as, again, a way to inform the work that people are doing really in any part of health or even across disability or aged care. We were contracted by the department to develop them around a very specific scope, which is mental health, suicide prevention, alcohol and other drug services. But really, when you look at them, there is nothing that's absolutely specific to those sectors, and they could equally be picked up and used for other parts of health or disability or aged care. And we would encourage people to have a look at them and use them to guide them in those sectors.
So we've got another question. Yeah, which is great. So they're not really specific to any sector, and they can be sort of broadly applied, which is great. So we've got a question from Robert, who's asking, how do these standards interact with the TGA software as a medical device process? So Peggy, sorry to ask you again. We'll get on to the other panellists, but if you can answer that one.
Yeah, that's essentially what I was referring to before, Sophie. So the TGA regulates medical devices, and where software meets that definition of a medical device, then they need to conform to the TGA regulatory framework. The TGA has recently reviewed that framework for software as a medical device and made some revisions to it. But we have been working with them to make sure, as I said, that we're not placing an additional burden on service providers or manufacturers. So generally speaking, if a product is required, if it meets the definition of a medical device and has to undergo the TGA regulatory framework, then they won't need to also meet our standards, because it's essentially a higher bar in a sense than ours. And they do have the capacity for issuing, kind of penalties and requirements of services, and it's a mandated thing. But for those digital mental health services that don't meet that definition, then our standards are the standards that they should look to, and we think that they'll do a lot to improve the safety and quality of all of those other services that don't meet the TGA requirement.
So I've had a question from a doctor who asks, how is the Commission going to educate consumers about the standard, and how will consumers be able to check if a service that they're using meets the standard? So maybe Nick, and then we can ask Sam and Eileen. So Nick, the question was, how do you think would the Commission or could educate consumers, or how can clinicians educate consumers about these standards? And how can consumers check to make sure that a service that they might be using, whether it is meeting some of the requirements of the standard?
Well, probably one of the first points to make is it's been great watching Peggy answer all those really difficult questions. In response to that question, look, I know the Commission's been thinking through clearly the communications strategy, and recognising that when you introduce things like regulations or standards, you don't just target one particular group, such as consumers. You have to target health professionals, training providers, and so on and so on. So I think a multi-level comms approach will unfold over the next year or two. But also bear in mind that the standards, while they're being launched today, they won't be officially required or adopted until for another 12 months or so. So this will be a work in progress. But I think everybody's very keen to ensure that there's common understanding of the importance of these standards, that there's a simple way for consumers to understand what service providers are offering, and if you like, that's almost simple tip sheet about who we are and what we do and what we don't do to help people make good informed decisions. So I think it'll evolve.
And so Sam and Eileen, how important do you think consumers will look at these standards and sort of try to cross-check them with whatever services that they are using? Do you think it's something that consumers are going to become engaged with, Sam?
Absolutely. I think that, I know that consumers do their history, they do their research, they do their background searches on not only their GPs, their clinicians, they do it on their services, they do it on locations, everything. So when it comes to a service that they'll be using or looking into using, 100% they'll be doing it. And so I think when it comes to cross-checking and some of the information that by aligning yourself with or your service with the national standards will provide, and the transparency that will provide, it'll really benefit consumers and carers when it comes to that information, particularly around choosing a service that's best fit.
And maybe, Eileen, I might get you to comment also from a carer's point of view. How important do you think it will be for carers to have these standards so that they can then look and see whether a service that they might be looking at for someone that they're caring for meets the requirements? How important do you think it'll be from a carer's point of view?
Well, from a carer's point of view, carers use these services for themselves, not just for the people that they're being supportive of. And the way that the majority of the Australian population finds out about anything is usually from someone else who's their friend. And so I think word of mouth, just like it might be for any other product or any other provision of any kind of service, is so important. Reputation is so important, and people's experience is so important. So the lived experience carers are going to be scrutinizing this just as carefully and see it as important as any consumer who's using it, not just for the sake of those they might recommend for family and friends and kin, but for themselves, because many of these online and digital provision of mental health services are there to support carers to be sustainable in their role as carers as well.
So we've had quite a few questions from the audience about training, and Evan's asking, will there be training about the content in the standards and how the standards can be really used effectively? So maybe back to Peggy. Has the Commission got thoughts about how whether could be workshops or training so that people could work out how to use the standards to the best of their ability?
Yes, Sophie, again, that's part of future work potentially. What we have in train at the moment, we're launching today the standards, the self-assessment tool and some fact sheets. We've got a user guide actually in development that will probably be available in the first half of next year. And we're looking, as Nick was indicating, around the different ways of communicating about the standards. The option of training is one that we have talked about. We haven't got any firm plans in place at this point in time, but I'm sure it's something the Commission will take on board, particularly if we're getting feedback from our webcast today that people think that's important.
Yes, and that's also good to get. We're trying to get through as many of the questions as we can today, but if there's anything that we don't get to, definitely get in touch with the Commission as well. And we've got a comment here about the tip sheet as well. The tip sheet that the Commission has developed will also be very important for consumers as well. Like, it's really sort of a very high level look at the most important parts of the standards. So that's something as well. And yes, another question about training. So I think that's obviously a bit of a key thing. I might just go. We've spoken a fair bit about the sort of technical side of things, but so I might just go to Sam and Eileen just to talk. We've only got about 5 minutes left. What do you think are the key things that consumers and people, service users, will take from the standards? What do you think are going to be the standout parts of the standards that will really be of most benefit to people who are using these types of services, whether they're consumers or carers? So Sam, what do you think, having sort of gone through the workshops and been working on this for quite a while, what do you think, what does your gut tell you that is going to be the most useful part of these standards?
Yeah, I think empowerment is the biggest one that comes to mind. I think we all know knowledge is power, or there is the old adage that knowledge is power, and the standards bring that knowledge to a consumer or a carer that is looking into services that are aligned with them and that have been accredited against them. And I think the other is respect. I think that by going with a service that is worthy of the standards, that they know that they're being treated with respect, with the data privacy, with the way in which the service values lived experience and the voice of lived experience and the history of lived experience. They know that their journey is safe with them, and I know that from an individual of lived experience myself. So I know that there is respect and empowerment coming with these, and it's been from the very beginning of this that lived experience has been at the heart. So I know that it absolutely is going to continue going with it.
Which is fantastic. And Eileen, what about from your point of view? I know both you and Sam was telling me that one of the best things about these standards is that people with lived experience were in there from the very beginning of, not sort of just brought in at the last minute, and that's been very important in terms of setting the standards up. But what do you feel is going to be the most benefit of the standards from a service user's point of view?
Yeah, I think all of us with lived experience as consumers and carers see the essential need for there to be accountability for all services that we make use of, that we provide ourselves or we partner with. And so I see the standards as a way towards that transparency, that accountability. And as we've been involved, and I don't just mean Sam and myself and the other consumers and carers who have been on all the processes, but across Australia, as those who are using digital services become part of the evaluation process and give the feedback that will be so essential for continuous improvement. Again, yeah, you have the standards to give the guidance for knowing with where things should be and how they could be. So it's essential, and I'm excited that it's already launched today this much, and we're still a work in progress with so much more that we're developing for evaluation and those processes. And as Peggy said before, some of the user guide provision of things for next year.
Yeah, so it's really just the beginning today. It's very much the start of the process. The fact the standards are being launched today, but it's by no means the end of it. And so I might just ask Peggy and Nick to also reflect on, we've only got a minute or so left, about what you're hoping will be the biggest benefit of the standards. Maybe we'll start with you, Nick, and then go to Peggy.
Well, probably the key points for me and the benefits of the standards are that they'll provide a benchmark, they'll raise the bar for the work that we're doing as a sector, and they'll help us support consumers to make really good informed decisions about service appropriateness, so people can select services which will help them most effectively on their journey. So that those are the main outcomes from me.
And what about you, Peggy? I know it's there's a lot in these standards, and it's hard to just sort of single out, one or two things. But what do you think of if you had to sort of, really crunch it down, what do you think are the most key benefits of having these standards now that they're being launched today, after all this hard work?
Yeah, look, Sophie, I think I would have to say that the key thing for me is that we've got this framework that sets out really clear expectations across all of those domains. None of them are more important than the other. They're all really important. And now it's clear for developers, for providers, for consumers, carers, clinicians, everybody. And hopefully we will have more digital services as time goes on. More of them will meet the expectations, and more mental health care will be delivered to those who need it.
Fantastic. Oh, well, look, that's a great note to wrap up our webinar today. So if you want to get the links to the standards, if you want to get the links to the fact sheets and everything else we've been talking about today, they're on the Commission's website. But if you follow the Commission on Twitter, I'll just repeat their Twitter handle is ACSQHC, and mine is Sophie Scott and the number 2. So we'll both on both Twitter and Instagram, we'll post the links to the standards and the fact sheet, and they'll also put out a link to the recording when it's available. So that way you don't feel like you're missing out on anything. We'll make sure that you get all that information, and it's a really great day. It's a world first, these standards for digital mental health care, and a real credit to everyone who's been involved in working on this project, including all our amazing panelists today. So thank you for being part of the panel. I'm sorry we didn't get to all the questions, but it's the start of this important process, not the end of it. So please engage with the Commission on their website or through Twitter and Instagram, and we'll get those links out to you and make sure that you get all the information that you need. But thank you for being part of the event today, and I hope you've enjoyed it. And yeah, we'll watch this space. And thank you very much for the panelists. It's been great to have you on board. Goodbye.